Bolton Council are delighted to support these awards, and I would like to congratulate all the finalists. The next category is Support for Independence. This award recognises teams that have involved people using their services to develop approaches that help them remain independent. And the finalists are Central and Eastern Cheshire NHS Primary Care Trust with the Wishing Well project, NHS Stockport Metropolitan Borough Council and Pennine Care NHS Foundation Trust with their Mental Health Self-Directed Support Project team, NHS North Lancashire, NHS East Lancashire, NHS Central Lancashire and Lancashire County Council's Adult Social Care Service with their Wellbeing and Prevention Team project. Let's have a closer look at these nominations.
The Wishing Well project started 7 years ago as a result of some research that was done into the disadvantaged areas of Crewe. At the time there was mainly 3 wards, so we applied for funding and got funded to deliver health projects to these 3 vital wards. After that funded ended, after 5 years, we then became a company limited by guarantee and became a social enterprise. At that time we were asked if we'd like to be involved with the projects in this building, which was a new build at the time, and we said yes, and from that we got the contract to run the community cafe, the IT information point and the advice service. That's as well as other activities we carried on running in the community, in schools and community centres, working on community health and initiatives. The project is community led, so we're actually running services that the community are asking for.
My role within the health centre is to run alongside with the volunteers a signposting service, which is quite unique because the health professionals and GPs refer the general public to come down. That can be for all different reasons to do with their general health and well-being. If they're feeling depressed, isolated, lonely, anxiety, they're struggling with parenting skills, all sorts. They've been on medication for long-term illnesses, and they're very isolated because they can't do a lot, or they feel they can't with their illness. They come along and chat. My role is to support them, to get them out and about doing things again, and it doesn't matter how that's done. So it can start as the chat, and then I can support them to take them along to other organisations, signpost them onto other organisations if that's what they need, or within our own organisation find them something that they will enjoy doing and go along with them, or buddy them up with someone or with a volunteer to go along, and that improves their confidence and self-esteem to go on to do other things quite naturally so, and possibly volunteer themselves as well.
The mental health self-directed support pilot that we've just finished, it's been 18 months in operation. We began in February 2009, just come to an end. Self-directed support is all about giving people the choice and the control and the financial means to choose for themselves what works best for them in terms of their recovery from mental health problems. So it's giving people real control over how they meet their needs for independence, if you like. So it's actually making payments, if they so wish, into their bank account. So it's quite a radical transformation in the way we do services. When we began the pilot, we didn't really know how to do it because it had never been done before. It was really quite innovative stuff, and we jumped in at the deep end. And so from a position of having maybe, I think we had just less than 20 people with a direct payment, which isn't unusual for mental health services, very small numbers. Within 18 months we had over 200. Which is a fantastic success. Those are people with a personal budget directing their own care and support and choice of intervention. What's really interesting is how we arrive at the amount of money somebody needs to meet their particular barriers that they've got to overcome to reach their goals and address their hopes and aspirations. You know, we funded belly dancing lessons and gardening equipment and gym membership and computers, cameras, clubs, college courses and so on. And it has indeed helped many people to take control over their care and support. Well, one of the first people who came on our pilot was a young woman who chose to spend some of her allocation of money on horse riding equipment, horse riding lessons, because it was something that she'd always wanted to do. So it's these stables here, going riding stables in Offerton, that she comes to, and it has made a huge difference to her.
Well, I think it's an excellent idea. It was a surprise when one of my social workers mentioned it to me, and she said that we could get the budget in and get you doing something, get you out of the house, get you, interacting with people, and especially like when you have a breakdown, it's not very nice. You sort of like switch off to people and you trust and your emotions, and you feel upset, you're anxious, you don't know where you're going or what you're doing, and I'm like up and down to the hospital and it's a nightmare, but coming here, it's like opened my eyes, and I've got feelings going on, I'm coming back to myself. It's great.
There's a number of risks with the project. Issues around whether or not it's equitable, whether it's fair to people. Should somebody have something and somebody else doesn't have it? Is it right to give people an opportunity to go on holiday when other people maybe can't afford that? We've had to battle with all kinds of scepticism and indeed cynicism at times. But the message of the outcomes, the difference it makes to people's lives, is what wins hearts and minds in the end and persuades people that this system does work.
Help Direct aims to support individuals across Lancashire with their problems before they reach crisis point, therefore saving costs on adult and community services. We do this by offering practical support, information and guidance, and by reaching out to people within their communities. Customer need tends to be different with each telephone call we receive. It can be something as simple as a mobile hairdresser to something as complex as 3 or 4 different issues where a customer wants to access an array of services to improve the quality of their life.
I went to the age concern and asked them if they could help me, to be honest with you. They sent me to Help Direct, yes. It just gave me peace of mind. Yes, because I thought, well, what have I done? I thought it was all my fault, you see. I thought, well, what have I done? But when he said he'd been in touch, or had a look and said he thought it was a scam, I thought, well, I feel a bit better about that, really, because you do hear about all these people trying to break into people's bank accounts and things, don't you?
We provide an holistic assessment of an individual person's needs. We do this in the format of a wellbeing measure tool wheel, covering the areas of employment and volunteering, leisure and learning, managing finances, home and garden, feeling safe in your home and community, community groups and involvement. When we're assessing someone, we ask them how they rate the area of their life under each of those headings. If they're rating themselves below 3, we will look into it. What do you feel you need to improve that area of your life? What can we do for you? We'll then go away, or we may do it with the customer and look into some services that can help them, and then we'll support them to access it. Following which, we will always collect the outcome of them accessing that service. Therefore, we know we are supporting them to improve the quality of their life.
And the winner of the 2010 Support for Independence category is Central and Eastern Cheshire NHS Primary Care Trust with the Wishing Well project.